So moving to the next type of imaging modality, we'll talk about what is known as a 3D sonography. 3D sonography. So for the 3D sonography, you just have to do it. You are visualizing something in 3D, all right, and it's mostly used for babies. All right, so the baby is in the mommy's tummy, so I want to monitor the baby to see if there's any abnormalities at all. So I'm actually trying to visualize the baby. All right, so in 2D is what most of our hospitals have. All right, 2D is this way. Okay, they have something like a triangle, but 3D is like you can actually view the baby, so it's a better way. All right, so the 3D sonography, or you can say it's a three-dimensional ultrasound, it's an advanced imaging technique. All right, so to transform this 2D what image, that before you can actually interpret it, you must be professional. You can convert it to something that is very much more understandable. You understand? So it transforms what traditional 2D grayscale ultrasounds, okay, into what volumetric data sets. So it will allow the clinicians to actually view better. Do you understand? It will help you to view these things better. You understand? So how it works, it uses what specialized probes and softwares. It actually captures 2D. Do you understand? But when it captures the 2D, it transforms the 2D. So these images are what reconstructed into what a 3D volume that can be rotated, sliced, and analyzed retrospectively. All right. So it can be collected via freehand scanning. It can be mechanical probe. All those probes that will be touching on the stomach of the pregnant woman. Okay. The endoprobe insertion, matrix array, transducers. All of these are possible ways. You understand? So clinical application, of course, is very, very much more applied in what gynecology, because I want to actually view the baby. I want to look at the health of the baby. I want to dictate if there's any problems to the baby. You understand? Then in gynecology, that's obstetrics, babies, right? Gynecology, I just want to visualize the woman, see if there's any issues with her uterus, see if she has any fibroids, see if she has any polyps. Then also for the heart, okay, I want to view if there's any issue with the heart, in the structure or the function, all right. Then also it can help you to guide you. Let me say you want to do a surgery inside someone, so the ultrasound is guiding you, okay, as you are doing the. So let me say you want to take up some amniotic fluid. All right, the ultrasound is guiding you so that you don't pinch the baby. Do you understand? So it can also help you in real-time guidance for surgical procedures. So benefits of this 3D over the 2D is for 3D there's improved view. All right, there's reduced operator dependence. Like you don't really need a specialized staff to interpret things for you. Of course, if I see this, I'm seeing a baby. Do you understand? Then even the mother can be following up, right, to what you are explaining. Enables retrospective review of stored volume, enhances diagnostic accuracy. It can help you to make the right decisions. Of course, if I see that this baby has a problem with their head, it's very, very obvious. Do you understand? So that's just it for the 3D sonography, or you say the three-dimensional ultrasound.